Well, good afternoon, everybody. Sorry about the technical delay there. I want to thank you for joining today's update on COVID-19 in North Carolina. UNC-TV is providing a stream for sign language at unctv.org. As of today, we have 13,868 confirmed cases, 515 people in the hospital, and 527 deaths. At every briefing since our state's first death, I've shared the number of fatalities due to COVID-19. As North Carolina moves into Phase 1 today, I want everyone to remember what those numbers mean. Every time our state counts another death, a family and a community descend into mourning. I want to share with you some of their stories. One of them belongs to a man from Montgomery County known as Officer Bud. He served as a sheriff's deputy and school resource officer for 14 years and was in good health, never missing work or calling in sick. One person described him as a superhero. A local mom recalled how he sat and talked with her son who was frequently bullied and had found himself alone at a school dance. Officer Bud made home visits if he was worried about a student's home life that might be troubled. His motto was, anything for the kids. He died March 31st at the age of 43. One friend suggested that in death, he was still protecting his community by raising awareness of this virus. Alexander Reginald Pettiway joined the Durham County Sheriff's Office and served as an officer there for 23 years. He died in April from COVID-19 at the age of 55. He was well respected by his colleagues and described as a unique, gentle soul who will be missed by all. Lloyd Lamb of Leicester served in the Army and after retiring spent his time as a Sam's Club greeter. He rode the school bus, helping disabled children get on and off the bus, always there to look out for them and protect them. He died on March the 28th. Janice Carolyn Philbeck Greene of Falston owned Jan's restaurant. An employee said Jan wasn't just your boss, she was your friend forever. Her community told stories of Jan looking out for people in need, serving up a meal and helping them with a little gas money. She'd send food whenever a family had a funeral. Jan died on Easter Sunday. These are just a few of the stories running deep in communities across the state right now. As we make decisions and debate issues surrounding this virus, we must realize that each number represents the death of a real person. COVID-19 is a lethal threat. It is a cruel virus, causing grave harm in sometimes otherwise healthy people, separating people from their loved ones at the darkest of hours, and taking our everyday heroes away from us. But what we've learned in their deaths and from research is how to limit the spread of the virus. And I urge everyone to do what we know works and to stay vigilant. And even though today at 5 p.m., North Carolina moves into Phase 1, know that the stay-at-home order is still in effect. It's still better to stay home if you can. However, in Phase 1, there are more allowable reasons to leave home, including to engage in commerce and help give the economy a boost. We can enter Phase 1 because the indicators that we laid out 2 weeks ago, the data and the science, show that we can. So, what's different? Phase 1 is a careful, modest step to reigniting our economy while keeping important safety rules in place. The gathering limit of 10 people remains in effect, but more businesses can be open and people are allowed to visit them with important safety rules in place. State parks will be open too. We still need to keep certain businesses closed or limited during this phase. Public health experts have explained that any place where people sit or stand still for more than 10 minutes, especially indoors, greatly increases the risk of spreading this virus. And as we go out more, we must all get used to the 3 W's: wearing a face covering, waiting 6 feet apart from others, and washing our hands frequently. This is the face covering that I wear here at the Emergency Operations Center and that all of us wear. A face covering helps protect other people around you. So wear that face covering, wait 6 feet apart, and wash your hands. I think the weather will be nice this weekend for Mother's Day, and I hope everyone can get out and get some fresh air and sunshine. But be smart. Protect yourself and your loved ones. This week marked special recognition for several important groups of people, and it turns out that we honor many of our heroes at the same time every year. Nurses, law enforcement officers, correctional officers, and teachers all share the same Appreciation Week. This pandemic has taught us how truly valuable the people who work in these jobs are. We're grateful for them, and all of our first responders and frontline workers. They are showing us how teamwork, dedication, and sacrifice will get our state to the other side of this pandemic. With me today is the Secretary of Health and Human Services, Dr. Mandy Cohen, our Secretary of Public Safety, Eric Hooks, our Director of Emergency Management, Mike Sprayberry. Nicole Fox and Karen Magoon are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. Now we'll hear from Dr. Cohen.
Thank you, Governor. As we prepare to move into Phase 1, the modified stay-at-home order, we remain laser-focused on our testing, tracing, and trends. Earlier this week, we shared where we were on trends, and today I want to go through where we are on testing. When we outlined the path forward to ease restrictions back in April, we said that we wanted to double our day-over-day testing from about 2,500 to 3,000 tests per day to 5,000 to 7,000 tests per day, and we've hit our goal. 7 of the last 10 days, we're testing close to 6,000 people per day on average. We rank 15th in the nation in total number of tests completed. Now, while I think we're on the right track, I am not at all satisfied where we are. The Governor and I want to see more testing across the state, particularly in our underserved communities. I have a few updates on some new supports for testing from the federal government that will help us moving forward. Last week, we were able to secure sample collection supplies from the federal government, including 300,000 swabs and 224,000 viral transport media. Deliveries are expected weekly through June, and we'll begin distributing these to our local partners across the state. Good news. We're also working with the federal government and some corporate partners to bring additional testing sites to North Carolina. Walmart and Walgreens have opened federally supported testing sites in Durham and Pitt counties this week. Later this month, Walmart and Harris Teeter will open additional sites in Bladen, Columbus, Cumberland, Edgecombe, Guilford, Hoke, Jackson, and Wilkes counties. Also good news. The tests at these sites are paid for by the federal government, so there is no cost for the people getting tests. Another great piece of news. You can sign up for testing at these sites by making an appointment on their web portal. I also want to thank our commercial and hospital labs right here in the state of North Carolina who are partnering with us and with one another in unprecedented ways. We have a shared goal of statewide testing in all 100 counties, and leaders from these labs, along with representatives from healthcare organizations and folks from our team, have been meeting regularly to try to achieve this goal. They've already expanded laboratory capacity and are developing recommendations to increase testing, particularly for our vulnerable populations. They've also established a scientific study council evaluating new test methods. As we continue to ramp up testing, the funding provided in the state's COVID-19 relief bill will help, but there's plenty more work to do ahead of us. And I look forward to working with the General Assembly when they return to do all that we can to protect the health and well-being of North Carolinians. As we prepare to move to phase 1, I've also received some questions as to why more businesses and more activities aren't included in this first phase. Given the nature of this virus, given it's highly contagious and it can be dangerous and sometimes deadly for some, we need to approach this easing of restrictions in a measured way. That's why in phase 1, as the governor mentioned, we started with lower risk activities, where people are largely walking around if they go indoors, and where it's easiest to social distance at places like a clothing store or a florist. Hint, it's Mother's Day. In 2 weeks, we will reassess where we are on our trends, and hopefully we'll be able to move to phase 2, where we can layer on some of the higher risk activities where you may not be able to social distance or you're sitting for more prolonged periods of time. Sitting, such as, in a restaurant or at a worship services. Those activities still have risks, and we'll need to do all the things we can to keep from spreading the virus as we do those additional activities. So as we move into phase 1 this evening, you should still stay home if you can, but if you do leave, remember your 3 W's. Wear, wait, wash. Wear a cloth face covering if you will be with other people. Wait 6 feet apart and avoid close contact. Wash your hands often with soap and water for at least 20 seconds or use hand sanitizer. Follow the 3 W's, not just for you, but also as we approach Mother's Day this weekend. Make sure you do the 3 W's for your mom or your grandma. Yeah, okay, I'm throwing in a little mom guilt out there, but I know moms everywhere want to protect their families and loved ones during this difficult time. One of the easiest gifts you can give your mom or your grandmother is one where she can know you're doing your part to protect those around you. I want to wish a very happy Mother's Day to my fellow moms, and in particular to my mom. Love you, Mom. Thanks.
And now we'll hear from Mike Sprayberry. Mike.
Thank you, Governor, and thank you for your leadership. Good afternoon. Today is day 60 of the State Emergency Operations Center's COVID-19 response. Yesterday, we received the good news that FEMA has approved our extension request for the non-congregate sheltering program until June the 6th. This allows for reimbursement of hotels, motels, and other types of sheltering for people at higher risk for COVID-19, people needing to be isolated, or people needing a place to recover. Currently, 37 counties are using the program to house about 550 people. As we continue to obtain personal protective equipment, teams delivered to 36 counties and 2 healthcare preparedness coalitions yesterday. Shipments included masks, gloves, face shields, goggles, hair and shoe covers, as well as a few gowns. As we begin to ease restrictions and continue to plan for the months ahead, we are working with our CERT partners on forecasting downstream needs to support our healthcare partners, public safety agency, and other critical infrastructure as far as PPE. Also, as we close out Hurricane Preparedness Week, we want to make sure your family knows how to get information from reliable sources and has multiple ways to receive emergency information when severe weather threatens. A NOAA weather radio will alert you when warnings are issued in your location. A weather app on your phone can also alert you. And be sure to turn on built-in emergency alerts in the settings on your smartphone. This will allow you to receive emergency messages like evacuation orders from your local or state government, or serious warnings from the National Weather Service. If you live in a coastal county, check your new Know Your Zone website to see if you live in a predetermined evacuation zone. Visit knowyourzone.nc.gov. That's knowyourzone.nc.gov and enter your address in the searchable map. Find letter designation of your zone and remember it. So know your zone, and an evacuation order is issued by your local government. Be sure to follow it. At the Know Your Zone website, you can also find our brand new North Carolina Hurricane Guide with much more information to help you prepare and to stay safe during the upcoming hurricane season. I also like to echo Governor Cooper's and Dr. Cohen's comments regarding the move to Phase 1 this weekend. Be sure to stay distanced and to stay safe as you go about your new activities at parks or stores. Remember to wear a cloth face mask covering, wait at least 6 feet apart, and wash your hands often. That's wear, wait, and wash. And as always, don't forget to look out for your family, friends, and neighbors, and to recognize your mom and the moms in your life on Mother's Day. With kindness and cooperation, we'll all get through this together as one team, one mission, and one family. Thank you, Governor.
Thank you, Mike. We'll now take questions from the media. If you can identify yourself and your organization when you ask us, we appreciate it. We'll take the first question.
Our first question will be from Liz Schlemmer, North Carolina Public Radio.
Hi, Governor. This is Liz Schlemmer from North Carolina Public Radio. I wanted to ask, what is the state doing to monitor outbreaks and protect staff and inmates at state prisons, particularly given that Treasurer Falwell's plan to directly test state prison employees fell through earlier this week, and we're still waiting on more information from the Department of Public Safety about the measures that they're taking to protect inmates and staff?
First, we want to make sure that protecting inmates and corrections staff is at the forefront of our efforts. And we know that part of that is testing. We know that we need to do more testing all across the state. And I'm going to let Secretary Hooks talk about that specific situation. Secretary Hooks, if you could come forward.
Thank you, Governor. Thank you for the question as well. Just as the Governor said, testing is a vital part of our overall fight for COVID-19. Our teams in Department of Public Safety continue to work with the State Health Plan under the leadership of Treasurer Falwell as we develop plans to do alternative testing. We have not come to a full developed plan, but we are having great discussions. We just opted not, for operational concerns, not to do mass testing on those facility grounds.
Thanks very much. Next question, please.
Ashley Talley, WRAL.
Hi, Governor and Dr. Cohen. I have two quick questions for you. First, have you all considered requiring businesses to have their workers wear masks so that people feel more comfortable going into their place of business? And secondly, if you're able to address something that our reporter Joe Fisher had asked about earlier this week, have you gotten any closer toward making records public about meat processing plants for the safety of the workers and the public? Thank you.
We want to make sure that employees are protected all across our state. And we've had lots of conversations with businesses, and I think that they know that it is important for them to make sure that their employees are wearing face coverings in order to protect other employees. And I think that if we see that this is not being done, that we could make this mandatory. But I'm going to let Dr. Cohen address that and the other question too.
Thank you, Governor, and thanks for the question. So, yeah, that is correct that the face coverings is highly encouraged but not required. We know that there are circumstances where folks may have difficulty with breathing or other medical conditions that would not be conducive to face coverings, so we did not make that mandatory. But as the Governor said, if we see that folks are not complying with this, again, it's an act of kindness to your fellow neighbors and to others around you, so we hope everyone will be wearing those face coverings. As far as what we're doing related to our food processing plants, as you know, that those are companies that have now been directed by the President of the United States to remain open. We know to run those factories that the workers need to be in closer contact. So our work at Public Health has been to continue to help these organizations protect their workers. That includes everything from screening them on the way in with temperature checks, making sure that they are wearing face coverings or the appropriate masks, putting up barriers where that's appropriate, potentially slowing down the production line to allow for more social distancing. So we've been working and providing that assistance. The federal government, the CDC, is actually giving us some additional personnel to help us do that work and go to these sites to make sure that folks are following these guidelines. And as we go forward, we will continue to do that work. Obviously, this is an industry that's highly regulated by the Department of Agriculture, and we have heard folks' requests for some additional information and numbers. We want to make sure anything that we put on our website have accurate numbers, have complete numbers. And again, these are businesses that are not regulated by DHHS, not required to report to us. So we're trying to work through how we collect that information and then feed that back to you in the public. What I would say in the meantime, we have put out information about cases by zip code. So that's a lot of information for any community to have about, hey, what's going on in terms of case counts in my area. So as I would direct folks to those zip code level data for information that they might be interested in near them in terms of case counts. Thank you.
Thank you. Next question, please.
Dawn Vaughn, News and Observer.
Hi, thanks for taking our questions. This is Dawn Vaughn with the News and Observer. So Georgia Public Health announced last night that they're offering testing regardless of symptoms. When can North Carolinians expect to have that, and what exactly needs to happen before we can get to that point?
We have put testing and getting more testing is a priority for North Carolina. We know that as we move through these phases that we're going to have more testing and tracing out there. Our testing surge group is doing everything they can to increase the number of tests that are out there. And I want Dr. Cohen to talk specifically about how we've expanded the criteria and how more people are going to have an opportunity to be tested in North Carolina.
Thank you, Governor. That's right. Anyone who needs a test in North Carolina should be getting tested right now. As I mentioned earlier, we have a number of new testing sites that are available. So for a period of time, while we were still struggling with supply chains and issues, there were more restrictions. But now anyone who has symptoms of COVID-19, cough, fever, we ask you to call your primary care doctor or other clinician, talk about your symptoms and get referred for a test. We also want anyone who's been exposed to COVID-19 to get a test, whether or not you're having symptoms. So you don't have to have symptoms in order to get a test. If you've been exposed, we want you to get testing. Of course, there are particular circumstances like our healthcare workers, some of our congregate settings, our correctional facilities. That is where we're doing much more extensive testing given the nature of those jobs, the nature of those living situations. So there are some differences in terms of testing for those, but we keep working to increase testing overall. But so anyone who needs a test in North Carolina can get a test right now. Thank you.
Thank you. Next question.
Derek Dellinger, Fox 46.
Yes, Governor and Dr. Cohen. We got a chance to speak to people, and many believe, and in fact, I spoke with one couple specifically that are state employees. They said that they feel that it is too soon to reopen, and some of the polling that we've seen does reflect this. Is there anything you would say to those that are still hesitant or still worried that this is too soon? As we go into phase one, they are worried about seeing these spikes in cases. Do you have anything to say to them?
If you look at what we're doing, this is a very cautious move to phase one. It is intended to help to reignite our economy. I would encourage people to realize that the stay-at-home order is still in effect, and that we are basing these decisions on the data and the evidence that we see. We want to make sure that we don't overrun our hospitals. We want to make sure that our numbers of percentage of positive tests are leveling. We want to make sure that we've got the proper testing in place, and we've met those indicators to go into phase one, and we want people to continue to be careful. So we think this is a prudent, careful, cautious step that we should make, and we're going to continue to rely on the evidence and the data in order to make decisions about when we go into phase two. Thanks. Next question, please.
Dewan Hogard, WTVB.
Hi, Governor. Thanks so much for having us today. This is a question either for you or for Dr. Cohen. When will we actually get a much clearer picture of how many current or active cases we have of COVID-19 in the state? And once we get that number, what time frame should we be looking at to best measure trending? A week, 14 days, 28 days, et cetera?
Hi, Dewan. Thanks for that question. Yes, we know recovery is something we're working to report. We know folks are recovering from this virus. We know some, unfortunately, are losing their battle with COVID-19, as the governor talked about today, but many, many more. The vast majority of folks are recovering from this. We've worked with the CDC on a shared understanding of how we define recovery. I'm hoping either today or the early part of next week we'll be able to start reporting those numbers, so stay tuned. We hear you.
Thank you. Next question, please.
Michael Hyland, CBS 17.
Hi, Governor. This is Michael Hyland from CBS 17. I've noticed in today's press conference, I don't believe anybody has used the word reopening to describe what's happening today. You've used the words easing restrictions. Should anyone view what's happening tonight in North Carolina as the first phase of reopening the state? Thank you.
Well, we've had a lot of businesses already open in North Carolina. A number of businesses were declared as essential in our state, and a lot of our front-line workers are out there doing the jobs that we need to keep our economy going, to put food on the table, to make sure we administer health care. What we're doing is a careful approach of allowing more businesses to open and eliminating that essential, non-essential distinction. So we're just allowing more businesses to open and then keeping the stay-at-home order and allowing people to go out and visit those businesses. Remember that there are a lot of other businesses that still are not allowed to open in phase two, and in fact, all of the businesses in phase one, all of the businesses that were closed before are still closed in phase one that were specifically closed, like the restaurants only for takeout and delivery, and bars and bowling alleys, and all of these places where it is very difficult to socially distant inside and which draw crowds. And the health experts believe that we should wait a while longer before opening those. But I think that this is a cautious, prudent move that we should make. It's clear that we need to push and boost the economy, and we think that this can help, and this is the right way to do it. Thanks. Next question, please.
Jennifer Emmert, WLOS.
Thank you, Governor, for taking my question. This is Jennifer Emmert with WLOS News 13 in Asheville. As we are reopening, we're still getting a lot of emails from folks that are still struggling with those unemployment claims. How long is it taking the state to determine if an unemployment claim is valid and then for relief to start? And we've got a lot of people that say they've got errors on their applications, and so they're still not getting that claim processed and struggling to meet their bills.
So far, 460,000 plus North Carolinians are receiving unemployment benefits, and there are thousands of people who are continuing to file every day. And we know that those families are struggling and that every claim is important. The Employment Security Commission has worked to expand the number of people that they have on the telephone now to over 1,000. They have opened up an online chat function, which thousands of people have taken advantage of this week. I am pushing them because they know that people out there need this help. They've moved hours into the weekend and into the evening. So they're working hard at this. This is a high priority of our administration, and more people will continue to start receiving these unemployment benefits. This is important not only to those families, but to the economy. And just one last thing, remember that we were talking about an office that had handled about 12,000 claims a month, and now in a period of 2 months, they have over 1 million claims. They're working hard at it, and I'm going to keep pushing them, and it's important to make sure these families get relief. Thanks for that. Next question, please.
Reuben Jones, Spectrum News.
Hey, good afternoon. This is Reuben Jones from Spectrum News. I'm curious how worried, though, you are that as we enter phase one, people will go out more than they should be, and that there will be an increase in numbers over the next couple of weeks. And if you do see that, Governor, you mentioned a few weeks ago that you could look at a regional approach for tackling this. Do you see that coming at any point?
Well, first, we'll be able to know how people are doing by the number of positive tests we have, by the percentage of positive tests, by the number of people who are in the hospital, by the number of pre-COVID syndromic symptoms that people are exhibiting when they go into the emergency room. So we'll know how we're doing. And if the people of North Carolina do things to spread more virus and more people get sick, then we'll know that we don't yet need to go into phase two because our evidence will show us otherwise. I think this is the right move at the right time. We're encouraging people to be careful, and I think people have learned a lot. Yes, people are going to go out more because it's warmer and it's going to be Mother's Day weekend. I think that's fine. There's less a chance of spreading the virus outdoors. We want people to be outdoors, but we want them to continue to be socially distant and to wear a cloth covering and to keep washing their hands. But I have confidence in the people of North Carolina being able to do this in the right way, because I think people do want to see us move into phase two. We're all in this together, and you can go on the website and check for yourself how North Carolinians are doing. And we're hoping the next 2 weeks that the numbers will be favorable for us, but if they aren't, then we won't go into phase two. Thanks. Next question, please.
Our final question today will be from Erica Bryant from WSOC.
Thank you, Governor. First, a follow-up question to Mr. Hooks. You stated that you had decided to pause the movement on work at the prisons on this issue. What can you say about when you plan to begin again to make sure that testing and tracing and treatment is being provided in the prisons along with masks and 6 feet distancing? And follow-up question, mental health is very important for many in the community. I know gyms remain closed, but what about people who are personal trainers or who have private studios? Are they able to train people one at a time or in small groups with masks, taking temperature checks, and at a distance?
Thanks for that multi-pronged question there. Let me address a couple of things. Number one, it is important to test not only in our correctional facilities but all across the state, and I know that we need to continue to do that. Secondly, mental health is an issue, and we think it's important for people to get outside and to talk to each other, but also to be able to have access to a mental health therapist. And not only mental health, but we want people now, as we enter into phase one, to go and see their doctors for treatment of chronic conditions, to have their preventive health care, to make sure their children have their vaccinations. Because one of the things that may have been suffering here during this time of COVID-19, that people have sometimes ignored other health issues that they have. And I think it's extremely important for people to take care of those healthcare issues. So I'm going to have Secretary Hooks to talk one more time about the situation with the correctional facilities, and I'm going to have Dr. Cohen follow up to talk about the personal trainer.
Thank you, Governor. Again, thank you for the question. I just want to make it abundantly clear in the clarification. We have not paused testing in that regard. Testing is carried out in accordance to CDC and DHHS guidelines and guidance that they provide to us. Individuals that need a test will be tested. What I was referring to from the previous question was would we do mass testing on site at prison facilities, and that is what I was talking about as far as that testing is available and ongoing in other venues, and so we opted not to do that. A full range of all the things that we are doing to protect our staff and our inmates are available to you at ncdps.gov.
And just to quickly end with discussion about gyms, yes, we put gyms in a phase 2 activity. Again, we tried to group higher risk activities in phase 2 where we know that there is more risk of spread of the virus. And there's been a number of reports, even in the last number of days, that sort of gave folks a sense of risk at retail establishments versus restaurants versus gyms. And we know gyms is a place where that there is higher risk, even when you can be socially distant, but we know there's a lot of sweating and other things. And so we did keep that for phase 2. When we move into phase 2, we're going to have some additional requirements that you mentioned in your question to keep everyone safe as we go forward. And just thank everyone for continuing to do the 3 W's as we go into this first phase 1. And I know if we do this together, we'll be holding steady on our trends and moving into phase 2. Back to you, Governor.
Thank you all for being with us today. Have a great Mother's Day weekend and be safe, everybody. Thank you.